when we're leading an organization, it's great to stay focused on all the work that you do and all the work that you get funded for. But it's sometimes you have to be a bigger leader and you have to fight for the principles that impact your community and your constituents. And if you don't do that, then you allow people in government and elected office to run you over.
Welcome to Interview from theline.info. I'm your host, Jacob Rueda. In today's video, we will be discussing community nonprofits with a particular attention to an organization called the Wall-Las Memorias, which is based in Los Angeles. And here to talk with me is Mr. Richard Zaldivar, who is the founder and executive director of the Wall-Las Memorias Project. Mr. Zaldivar, thank you for taking the time to speak with me today.
Oh, it's such a pleasure to be with you, Jacob.
Oh, it's my pleasure, sir. Thank you very much. I want to go back to the beginning. When was the organization started and why?
So the organization was actually started on December the 1st, 1993, which happens to be World AIDS Day. And my best friend contracted HIV back in 1989. And in those days, it was a much different situation than we find ourselves today. There were no really medications for those living with HIV, and they were just starting out. And two, the stigma was so heavy. I remember his face being very sad, and he was very removed from family and friends because he didn't know how to deal with it because of the stigma and the shame connected to HIV. So I thought of building a monument to people who passed away from AIDS in the Latino community to have a sense of ownership of the issue. I learned in my life that when you build something in a community and you bring community together to do that, there's ownership. And that's what HIV AIDS is. And that's when we started the project, the organization, and that's how it was founded.
The name of the organization is the Wall-Las Memorias. Las Memorias translates to the memories in Spanish. What relation do memories have to the mission and the vision of the organization?
I think memories and the role that memories play in our life is extremely important. I think now that I'm much older than I was 30 years ago, there are times that I get to remember things that took place in my life that were both happy and sad. But I also get to learn from those experiences, whether it's my relationship with my father or somebody else, that I learned something from that. But it took me so many more years to reflect on the learning opportunity that I experienced. With HIV/AIDS in our community, for the most part, there was so much shame connected to those who had AIDS, and even more so those who died of AIDS. I have some good acquaintances that are prominent folks in community that still cannot visit the AIDS monument because they feel guilty of not putting their loved one's name on there because it's too painful. And so it's important for all of us individually, collectively, as a community, to remember the devastation that AIDS caused our community. Remember those who passed, and then learn the lessons from that devastation. That's what the monument is all about. It's also about empowerment. You know, we can do anything we can in our lives. We built the nation's only publicly funded AIDS monument. And so I want people to, and people do, they learn from it, they get to grieve, but it's also a teaching tool for everyone to see the devastation that AIDS caused our community.
Where is the monument located and why was that location picked?
The monument is located at Lincoln Park in Northeast Los Angeles, which is in the city of LA, not too far away from LA County USC Medical Center. The location was picked, which is really a great question. One is not too many parks allowed nonprofits to come onto their property. In my last life, I worked for a member of city council where he became the first council member to allow a nonprofit to go into a park, which was Lincoln Park, and allowed Plaza de la Raza, which is a nonprofit theatrical organization, to open up on park space. So there was always a precedent already in that park. And then the second part of the reason why we picked Lincoln Park is that it also had a reflected movements, political movements of the past, whether it was a Chicano movement or whether it was communities coming together that were very angry about the lack of services. So we thought Lincoln Park would be appropriate. Down the street from the monument is Parque de Mexico, which is a historical plaza of statues of leaders and presidents of Mexico. And then down the street from there was the largest HIV/AIDS hospital organization at 5P21. It was a clinic that served AIDS patients just half a mile away from the AIDS monument. So we thought there was a lot of great connection.
What was the situation like for gay and lesbian Hispanics during that period for the wall when it was established originally?
You know, it was a different time back in 1993, 1991, 1992, those early years. Our community did not address LGBT. The perception back there was only white gay men were actually gay. My mijo couldn't be gay. My brother is queer, but as long as my dad doesn't find out. It was a different situation. So when a community is suppressed, as gay or bisexual men were back then you tend to do things that are not necessarily healthy choices. So we could talk about, having unprotected sex, uh, getting into high rates of alcoholism and drug abuse, because it numbs our feelings and we get to feel a little bit more liberated to love another gay man or have sex with another gay man. So it was a different time period. And during those years, as I started this organization, um, it was I was still in the closet back in 1992 and 1990, and I remember going up to San Francisco because I wanted to experience what gay life was, and I went for the weekend, and it was the worst weekend I've ever experienced. And that I went through the Castro in San Francisco, walking the streets, and it was deserted. And I remember going to this bar there in the Castro. And as I walked in and I had a drink back then, because I was drinking in those days, um, I remember the faces around the bar, and there must have been 10 people in the bar, about 6 o'clock in the afternoon on Friday. And you talk about depressed faces, depression. People were not smiling, they weren't interacting, and I felt like I walked into another country. And so it really played a key role. Then you hear whispers, back then about so and so has AIDS. Well, I didn't know he was gay. Yeah, he's gay. He's in the down low. And so it's a different era. We've come a long way, but there were soldiers that fought the war that died for us because no one was out there fighting for them, and there was no medications to sustain their lives. And so it was a different time.
What have you seen since that period until now? What has changed? Or maybe what has been the greatest change from that period until now?
I think the greatest change, and then maybe why the greatest change. The greatest change is there's a lot more openness to human sexuality, whether we define it by gender or identification, orientation, um, because there's a lot more conversation that has created a norm, the LGBTQ as a norm, right? And so we see shows, we see community leaders talking about our community. We see stories and movies and television series with gay characters. And for the most part, it's had a great positive contribution to the coming out of America. But it's not all has come out. So we still talk in our community. There are pockets of those who are very conservative, maybe conservative Christian backgrounds. We talk about immigrant experiences, which are not all that conservative, you know. And then we talk about Latinos across the nation or others who are not Latino across the nation that come from different cultures and communities. Like you can go to Kansas, you talk about the Texas or the Tejanos, you talk about the folks in Florida or Louisiana or Missouri. There are a lot of Latinos, and it's a little different, because you don't have bastions of gay communities, where people are thriving and people are interacting and creating safe spaces to be who we are. Um, so we're still fighting the fight. We're seeing an uptick of HIV cases, especially among Latinos, which is disturbing, but it also reflects the challenge that we have in front of us.
With regards to hate crimes, and especially with the stigmas, because they haven't gone away entirely. Um, I was reading a statistic that says that there's been more violence against members of the LGBTQ community in LA. What has been the Wall's response to that?
I think what we have done in the past is we've done a great job of creating coalitions to work together on projects. So we have worked very closely with the faith-based community for many years. We're the only organization that have had an HIV prevention program focusing on the Latino faith-based community for 15 years. Um, and so we also create partnerships that are true community partnerships and not necessarily gay or LGBTQ, which is really important. And so our job is to spread the word, educate. We provide toolkit trainings around how to create a safe space for our LGBTQ community. And it's presented in a very cultural manner where people understand, what are the cultural characteristics that contribute to homophobia in the Latino community? And how do we address those? How do we get by those to create a safer space? So we've done a really great job, in doing that and working with the churches early on. My first chairman of our board was a Catholic priest. Um, and it was all done politically because you want to leverage your relationships out and then share the responsibility of outreaching to community, right? And so we've done a great job. What I'm really concerned about is we're seeing an uptick of some hatred and some violence in our communities, is that we're also getting integrated into the right wing stuff. I was going to use another word. And so, you know, the right wing MAGA movement in, creates opportunities to fester around homophobia and racism and intolerance. And, you know, and that will happen because not everybody understands what a queer man or woman or transgender is. And they may love the person as a person, but they can't handle the sexual orientation or the identity. And so that's why we work with a number of organizations and institutions and churches and labor unions to sensitize them into making sure that we're all on the same page because we're all human, right? And so there's challenges ahead of us, but it's not only around LGBTQ, but it's about color, it's about immigrants, about language, and that's going to be the challenge, I know, for the next year or two.
I know this is going to sound rather philosophical, but with regard to the stigmas, is it just the right wing MAGA? I mean, does it extend beyond that? I mean, what's your take on that?
Well, no, it's not just the right wing MAGA. Extremism is the issue that we really need to focus in on because it's happening across the board, whether it's corporations, whether it's politicians, whether it's homophobes or transphobes, but it's also the churches. And so um, recently we had a situation where the Dodgers wanted to honor the Sisters of Perpetual Indulgence, right? Those sisters who are gay men who dress up as nuns and they are doing holy work, right? They work with the poor, the underserved populations. And the Catholic Church, well, kind of the Catholic Church, you had some spokespeople come out against them and call them names, and but they weren't really reflecting the Catholic Church. So even with the church, there is a division, in the Catholic Church, whether or not you practice is irrelevant because we're culturally raised Catholic and it's part of our Latino heritage. But nevertheless, there is a division. You have, moderates to the up to the Pope that are very pro LGBT, but you have a right wing group of bishops that are anti gay. And it's scary because they also take that to the political heights, of supporting issues that that real right wingers support. So, I think that, we got to look at all the areas or facets of, messages that come through and movements that take place and really look into what's causing these movements, what's causing these messages. And it seems to be the same right wing extremism that we're facing in this country, where they're incorporated, they're embedded in different movements to create the almost anti humanity, um, or anti-humane way of living. So that's my perspective.
From the moment the wall opened until now, what has the organization achieved in terms of outreach, education, and care for the community?
I'm going through this process of reflection. I'm a very type A personality. So once I get started on a project, I go and I just go at high speed. And so, as we're getting ready for the 30th anniversary and the year of celebration, I'm now reflecting on what we have done in the community. And I'm very proud of the work of the Wall-Las Memorias. And when I talk about the Wall-Las Memorias, it's not only the staff or the leadership, it's the community. Everybody has played a role. We have done work with the faith-based community for 15 years and changed mindsets. We planted seeds for many of the faith-based community around HIV, AIDS, and LGBTQ. We built an AIDS monument and we renovated the monument, and it is the most incredible space to be in Los Angeles or anywhere in the country. We have supported an AIDS hospice in Tijuana. In the year 2000, it was renamed after us as Albergue Las Memorias. And we still support them financially, whatever we can raise money, toiletries, items that we give to the clients there. We have done an incredible work of addressing mental health prevention services to the Latino and the LGBTQ transition age youth. We have done great work around, community organizing. We have stopped. Uh, we've addressed discrimination by restaurants in West Hollywood that were discriminating against people who had full-blown AIDS, their workers. We stopped a takeover by individuals who wanted to take over the NBC commissary, and we fought for the with the union to retain Latino workers at NBC. We started the Act Now Against Meth Coalition, which just this year, that movement was titled as a promising practice by the United States Academy of Medicine. The Act Now Against Meth, we brought together 22 organizations and UCLA to address what is going on in Los Angeles regarding crystal methamphetamines. What are we doing? What is public health doing? What do they need to do to address this issue in our community? We created 32 recommendations and submitted to the County Board of Supervisors, which are working on those recommendations to get feedback from those departments. That is huge. We have saved many lives through our men's group, providing spaces for gay, bisexual men to come and talk about their life experiences. We provided HIV testing to thousands of people in the Los Angeles County. We have created programs that are now being looked at as models. So we participate in South Carolina and their university system around community engagement. We're flying up to Sacramento soon to talk about our work with youth and substance use and how do we engage young people and get them involved in advocacy. We have been part of an effort to stop legislation in Sacramento that would have extended the drinking hours in California from 2 to 4 o'clock in the morning. because we thought it was not right, especially when we have liquor stores and bars, so many of them in underserved communities in California. So we've done a lot in the last 30 years. But I think the greatest contribution among all that was we've been able to demonstrate our passion, our ability to changing lives and to changing systems, and we've done it with dedication and unconditional love.
Let's shift gears for a moment. Recently, there was an issue with the LA City Council. There was an issue regarding some funding. And if at any moment there's some information that I get incorrect, I hope that you will correct me on it. There was a council member who introduced a motion in the city council, and they wanted to reallocate some funds that were traditionally reserved for the wall. And what that particular council member wanted to do was redirect those funds for community projects in their district. Now, the funding was originally put in place by the previous council member in that district. Now, on Tuesday, August 8th, the LA City Council gathered to hear comments on that proposed motion, and after deliberation and comments from you and other community members, the council voted for the wall to receive a reduced amount. What can you say about that experience and about the council's vote, as well as how the wall will be impacted by it?
Jacob, I think, yeah, that was a sad day. Um, you know, the reality, and you explained it so well. That money was part of a was voted by the city council back in 2022 when there were different council members there. It was allocated as part of the general fund. So that means it was voted by the council, signed by the mayor. Now comes new council members, they take office, and they try to move initially that money back into their account. And we raise objections. We asked for continuance. We got the continuance. We met with the council member to no avail. And then we went back to City Hall to fight against that. The council member at that time, Hernandez out of Council District 1, is a new member. And she's really clear that she was only going to give us $100,000 of the $500,000 commitment with strings attached, her dictating what she wanted us to spend that money on. We had previously offered those services because we get paid by the county to do that work. And so, the council is, um, I think they decided to support her on this issue only because there's some kind of council rules. Let's support each other because if something happens in my district, I want the same kind of response. Um, and so we did a great presentation. We had a series of supporters speaking. That was the second issue on the council agenda that day that happened to be impacting LGBTQ. The other issue was the Morris Kite House, which Morris Kite was a huge leader in our community. And a number of community organizations wanted to declare that a city monument status. And she was the same council member, Hernandez, was refusing that and did so until the very end. But after there was a full page ad in the LA Times about her being anti gay and also some pushback, I believe, from Dolores Huerta. And so at the last minute, she changed her mind, but she had two LGBTQ issues on the agenda on that same day. We were the sacrificial lamb. And so I, I understand the politics, um, but I don't understand the inequities when politicians make decisions. Here you are, the only organization that money was geared towards the AIDS monument for maintenance and for supportive services. We provide a lot of tours to young people in schools, about HIV/AIDS, and they love the monument, but we don't have staffing for that. And so she just came across as being short-sighted on that, and you know, we just we move forward, and we will continue to work with any council member, any elected official. But what we learned from all that is that we have significant power. We had tremendous support from the community, and many folks spoke up, and it regalvanized a tremendous amount of a movement. Because in Los Angeles in 2023, the LGBTQ community is still not safe, and we still don't have the heroes that we should have. So when we talk about social justice, it's not only about color or language, it's about sexual orientation and sexual identity. And so that's the bigger issue. So it tells us that our work is not completed. We have a lot more work to do.
Community nonprofits like The Wall come up against a lot of challenges and obstacles, as we've just heard. There's dealing with governmental leadership, there's red tape, and other bureaucratic elements. And I'm sure you're well aware. What does it take to not just build a relationship with government and work out some of those occasional frustrations, especially in situations like the one The Wall was in recently?
Great question, Jacob. I think, and I just had a breakfast meeting with another executive director, um, and we had some similar conversations. What we're noticing today is that in a lot of the nonprofits, you're having a shift taking place, especially after the COVID-19. We know that it's hard to retain employees, but we're also seeing senior leadership moving on to somewhere else. And so we're seeing a vacuum of those in those leadership positions. That's number one. Number two, I think it's important that when we're leading an organization, it's great to stay focused on all the work that you do and all the work that you get funded for. But it's sometimes you have to be a bigger leader, and you have to fight for the principles that impact your community and your constituents. And if you don't do that, then you allow people in government and elected office to run you over. Because they don't have the experience that nonprofits have. Elected officials are here one day and they may run for another office and they're gone somewhere else. Community-based organizations are a foundation in our neighborhoods. And so we need to speak up. What do we need? How can we change systems? How can we address a broader section of our community? And so it's all about leadership. Um, and then the second thing to add to that, excuse me, it's important for our leadership to speak up and take positions that sometimes are not popular. And when you do that, then you stand out as a leader, and you get to then create better relationships with those in power because they have more respect for you. You know, it's important not to get run over by power. It's important to take ownership for your own power and then move on with that power to change your community.
What are some of the things that you've realized along the way about working not just with government, but with people in a community and within the world of nonprofits specifically?
I think that what we need to do is have more conversation, because the people in government are no different than the people who work for me in this office. The people in the churches are no different than those people who work in the labor movement. Our issues are very similar. It's just that we're different. We're working from different silos. And those silos create barriers that we often have to break down just to have an honest, transparent conversation. So it's important for nonprofit leaders to take ownership and to walk into city halls and to county governments and state capitals like they own it. Because the reality is that they do own it. And government cannot function without community-based organizations. But you have to rise to that level of saying, no, I have this power and I genuinely speak for my constituents. If you don't do that, then you're allowing people to take your power away. Second of all, we have to be good ambassadors. We have to be trustworthy, responsible, and making sure that when people help you, you turn around back and help them. Um, but also learn to be bigger visionaries. So if I have a nonprofit here that we serve primarily health prevention services, I need to look, what is in pro environment? What does green mean to me? Now, we don't get funded to do that, but that's an important issue for our community. Clean water, in Southeast Los Angeles. You know, it's we don't get paid to do that, but we will take positions and we will be involved in situations that impact our community.
Let's switch gears for a moment and talk about COVID 19. Um, as you're aware, the public health emergency ended in May of this year after a period of 3 years. Now, cases are rising, and there is a new variant called Eris, but there's a booster on the way, according to the CDC. Having emerged from the pandemic, what was the toughest part of going through that period for whether it was you or the wall? And how is the organization addressing COVID 19 now?
It almost seems like it's decades ago, right? Um, it was very difficult. I remember when we first learned about COVID and about how the spread was impacting people's lives, that we contacted all our partners. We called the city, the county, the state. Finally, we talked to someone in the federal government because we had all these contracts. So how do you do this work if you can't see people in person? And finally, the person on the federal level says, do what you got to do. Don't worry about it. And so we shut down the office. We sent people home. We did Zoom. I had no clue what Zoom was. And we then created a lot of programming on virtual platforms. And we loaded the platforms. We had community town halls to the general community, both in English and Spanish, with mental health professionals, spiritual advisors, medical professionals. And then we started kicking off all of our programs, both virtually on Zoom, Facebook, and then Instagram. And the staff just took off on Instagram. We got so much response. We were looked to by one of the public health departments as having the best virtual social marketing outreach during the pandemic because we did a great job. Um, but it also took its toll on community. We have seen a lot of our members suffer greatly, and not just constituents or clients, but people in the field of healthcare. A few of those the last year overdosed from drugs. One took their own life because of the issue of isolation and loneliness during that period of time. It was scary for those who didn't have a partner, who didn't have a family, not knowing, when they're going to go back to work. And for some, work validates who you are. So when you're not functioning in that manner, then you're looking at yourself almost in a defeatist manner. You don't have a boyfriend, you don't have a girlfriend, you can't date. And when you do, you may be dating using drugs, maybe not. Drugs and alcohol was a huge outlet for folks. We're seeing that today with an increased use of drugs and alcohol in our community. We're talking about fentanyl and crystal methamphetamine. And so it really devastated our community. What it also did, I know it has done for me, for not necessarily, but the initiative, the idea. Do I take a chance in traveling to New York during the pandemic, or will I get sick? The hesitation. Do I risk going back to work? Do I risk asking Joe out for a date? Does he have COVID? It takes me back to the days of HIV. You know, oh, don't have sex unless you have a condom. There was hesitation. right? Is this going to be safe? So COVID played a huge, detrimental physically, but also emotionally and spiritually. Um, it put us all for a loss. So the challenges of all coming back, it's not just coming back into your office and looking at your computer screen and going to lunch with friends. It's about coming back out into society where society is today because we're all in that same level. Do I wear a mask, when I go to a coffee shop or not? There's a lot of tension. There's a lot of pressure to that. It is for us. We have to wear masks in the office because we do public health work. We go outside, we go to the elevator, we may take our mask off. Or we go to, take a metro or a bus. We put our mask, not everybody does. So that's tension. And then you look at the end of the day when you get ready to go to sleep after a long day of great positive work and then challenges, and you say, that's another challenge. You see the numbers climb. What are we missing here? Right? And so we're fortunate to have been working on COVID education and prevention. We just got another grant that extends through November to focus primarily LGBTQ community because still, we're going out to festivals, we're going out to bars, we're going out to clubs, and most of the guys are not wearing masks. Most of the women don't wear masks necessarily. So then how do we create that messaging to reminding them that there's a pandemic out there? And so there's still many challenges. Oh, and not to mention many of our family members who lost a loved one to COVID. There was no memorial service where people could come in and go to church and pray over a body. They couldn't do that. So what happened to all that tension? The closure. So we were devastated, just like the rest of the country or the world.
But even today, there's still a lot of stigma. Since we were talking about stigmas earlier, stigmas toward mask wearing, getting vaccinated, and there are still other ideas that people have about COVID. How do you address that? How do you address some of the objections or disbelief that people have?
Well, I think there are, for me, those who oppose masking and oppose the idea that there is a virus out there. I see it from two different lenses. One lens where you have people who may not be in tune to reading online or reading a newspaper or listening to the news, whether it's on Telemundo or a network, and being up to date. And so that's the community we really need to make sure we're educating in their language, in the way they understand. And then on the flip side, the second group of folks are just the folks that are anti-establishment. Those who we had a former president who didn't believe that the virus was real, and so that whole group of folks who are anti-maskers, anti-vaccines, anti-COVID, right? But they're also anti-other things. They're probably anti-Catholic, anti-Black, anti-Jewish, anti-queer, anti-immigrant, and those you're never going to be able to indoctrinate or provide education. You can pray for them. You can outreach to them to a degree, with respect, knowing that they may have pushback. Um, but those are the two groups that I see that poses um, a danger. And then the last one, I think that many of us Americans throughout the country, I know I like to get to that place of comfort again. I remember my partner and I living downtown, and although this took place in New York, right, and in different parts of the country, we still would go out on our little balcony. We lived on the 26th floor, and every night at 8 o'clock, people would come and clamp those pots, right, during the COVID, well, during the lockdown, and it was only our way of communicating with others, but also saluting those workers, those health workers. Um, and I think that we need to do a better job, all of us, of having conversations about COVID and its impact. And I think the message here is that we really need to talk about health justice. Health justice is about those people who have access to education and services, medical treatment for their health care. Um, and it's not only COVID, it's diabetes, it's liver cancer, it's HIV, it's depression, mental health. Um, it's a number of those issues. So we need to talk about health justice in general too, and COVID-19 comes under that.
Let's finish off with the economy, which is in a constant state of flux, especially now with inflation tapering down, but with interest rates going up. With all of the different ways that the Wall and other community nonprofits receive funding, whether it's through grants or donations or just public funding, how has the organization managed through those times, especially being that community nonprofits operate differently than regular business, state agencies, and even other nonprofits?
Um, I know the Wall-Las Memorias during COVID-19, we're like very one of the very few um, that actually increased our budget. And I'm grateful. Um, I'm not surprised because we do great work. And we were offered contracts. Can you do this? Can you do that? You've done such a great job. And so we increased. The challenge, of course, is not having the staff to be able to take those positions because still today staffing's in flux across the board. Um, but I think moving forward, I think we learned a lot too. We learned more about we need to do more for our workforce, making sure that we're paying attention to their needs, bringing in mental health professionals, having uh, special events where you bring staff together, whether it's a picnic or you bring people together for a sound bath, and you're giving something back to keep them together. Um, I have during COVID-19 had numerous conversations with staff in staff meetings just to chat. Conversation is important, especially when we're so glued to our telephone and texting, whether it's Instagram or TikTok. That does not address our emotional needs. Our emotional needs of being together, of feeling of being loved, and then the ability to love, right? And to express that. And so I think we have still a long way to go. And during this economy, I think it's important that we're seeing a lot of shifts going on, whether it's because became disinterested in our jobs, or whether our rent, like in Los Angeles, is so high, or it's very expensive to buy a house, or we're not being paid enough money to be able to drive and park in a parking lot for work. Those are real issues. Um, but I think we all need to move forward to finding out how we can fix the system and holding our elected officials accountable for that, which is extremely important. Um, but we will get through this. I think we have an incredible administration in Washington that's doing a great job of, I'm a student of politics. I My favorite president of all time was Lyndon Johnson for the work that he did on the economy and social justice, Civil Rights Act, Social Security, Medicare. Um, I think this president has exceeded that. He's done a lot more to address our needs, but the world is in flux. We're not the only country experiencing inflation. Most of the world is experiencing that same inflation, and COVID-19 had a great contribution to that. But we're also seeing a lot of our rights being taken away. So we talk about school boards fighting back against LGBTQ. We're seeing that also happening in Latin American countries. We see that happening in Russia, in other countries, in the Middle East. We're seeing an increase of new laws coming in to take away the rights of women and LGBTQ. So what we're experiencing in the United States is nothing compared to other parts of the world. And I just want to say that we need to make sure that we preserve our democracy because as a As a leader in my community, a gay man who's Latino, I know that I have a voice. And my voice many times is heard. But when we don't preserve or focus in on supporting democracies, then our voices are not heard. There's a presumption that, a change in systems will take care of everybody. And history dictates that that's not true. And the most underserved become erased from society. And so we got to keep that in the back of our minds when we're talking about community, making sure that we all get out to vote, making sure that we understand the candidates. And it doesn't matter if they're liberal or conservative or centrist. We got to make sure that we are reading through the BS that they're talking about many times, voting them in, the ones that represent our interests, and then holding them accountable.
Is there anything else that you'd like to share about the wall or nonprofits or any of the topics that we've covered that you feel people should know?
No, I think that, I want to just say that wherever, if you're in a nonprofit organization, if you're in school, if you're in government, if you're in a business and labor, the one thing I share with all of my staff and folks that I meet is that, no matter what time of period we're going through in the history of our country, in the history of our world, don't get lost. Um, know that you're born into this world for a specific purpose. And no matter what the challenge is, continue to find what your purpose is and then fulfill that purpose. Fulfill your mission on earth. Because we're all born into for a specific reason. Just make sure that when you pass, and there's going to be a day that we all die, that we make sure that we fulfilled our mission. That brings us joy, a sense of accomplishment, and sense of purpose. We'll get through this together.
All right. Well, that's all I have for you today. Thank you again, Mr. Richard Zaldivar, for joining me in discussion today.
Thank you, Jacob. God bless.
And God bless you too, sir. And to all of you watching, thank you for doing so. I do appreciate it. And if you like this video, be sure to subscribe to this channel for more interviews. And also be sure to follow theline.info on Instagram and Facebook. And be sure to check out the website, which is linked on social media and on this YouTube page. Until next time, take care.